Hello and welcome to this special show, Begin to Quit, to commemorate World No Tobacco Day. This is a day to renew efforts to create networks of support and increase access to services that have been proven to help tobacco users quit successfully. We all know that tobacco kills, but it doesn't make it easier to quit, especially in these times when anxiety has gone through the roof because of the COVID pandemic. While the journey of quitting can be challenging, it is worth it because when you quit, you choose life, you choose health, you choose happiness. Even if you have smoked all your life, it is worth it to stop. Today, we have experts joining us on this exclusive talk show. Aisha Blue Council, in an association with JB Chemicals and Pharmaceuticals, brings you Begin to Quit, a talk show to lead people towards the path of good health and strengthen India's fight against tobacco. Please welcome our expert panel. We are happy to welcome Dr. Nimesh G. Desai, Director, Institute of Human Behavior and Allied Sciences, IHBAS, Delhi. Dr. Pavan Gupta, Director, Head and Neck, Max Institute of Cancer Care, East Zone, Max Super Speciality Hospital, West Shali, Delhi NCR, and founder ICANN Canre. Dr. P.P. Mohanan, Director and HOD of Cardiology, West Fort High Tech Hospital, Thrissur, and President, Cardiology Society of India. Dr. Rajesh Parnakar, Director and Chief Consultant Pulmonologist, Get Well Hospital and Research Institute, Dhantoli, and National Secretary, Indian Chest Society. We are also happy to welcome Dr. Ashish Birla, General Manager, Medical JB Chemicals and Pharmaceuticals Limited, and Mr. Nikhil Chopra, Global CEO, JB Chemicals and Pharmaceuticals Limited. Thank you all for joining us here. We are happy to welcome you to this very special show where we really want to create an awareness that it is not easy to quit, but you can do it. Everybody who has the will can do it. And your expertise and insights on which is the best way forward is really welcome. Thank you all for joining us. Let me start with you, Dr. Pavan Gupta. Smokers are up to 22 times more likely to develop lung cancer in their lifetimes than non-smokers. And oral cancer is also amongst the top three cancers in our country, and it has a high mortality rate. Now, we have graphic pictures of on cigarette packets to discourage people from smoking. Does it work?
Of course, it does work. And presently, the government of India has made it that 70% of the cigarette packets have to be covered by such picture. Of course, means they are also looking at making it 90%. People do look at it, and they also at the same time try to avoid it. This is the two important factor. They look at it, they know something comes into their mind is that what they are doing is going to be wrong, but at the same time they avoid looking at it and they cover it up. And the reasons are many because of that, because that is what probably we are going to discuss today, the difficulties of quitting, the challenges of quitting. That is why they try to avoid it. So once we understand that it is wrong and how we can come over the challenges of quitting, then probably these pictures will have better effect.
Mhm. Dr. Desai, nearly 9 out of 10 adults who start smoking cigarettes, they start early, sometimes even by the age of 18. And the reason they smoke is because it's considered cool and there's peer pressure, and some even take it for emotional and psychological issues. But Dr. Pavan has told us that they know it's wrong, yet they're doing it. So, is smoking an addiction? As an addiction, is it a societal problem? Is it a personal problem? How can one quit? Dr. Desai, I would request you to please unmute yourself.
Yeah, missed that on the phone. Thank you. Thanks, Imani. Can I at the very start enlarge the scope of what we would like to discuss? In India, smoking is not the only issue. About half or two-thirds of the clinical and public health issues are actually related to the non-smoking chewed route or the oral route of tobacco. And so, one of the many situations in healthcare and other fields is when we try and kind of just follow what the West has been doing. West obviously talks only about smoking. you know. And so I really make a strong plea for enlarging the scope to tobacco issues,
Yes,
tobacco
sir.
control.
Yes,
And like you said,
we want to
Gupta,
understand, how to quit tobacco, whether you
yes,
do it,
and
whether you smoke it.
like you and Dr. Gupta said, see, in the larger strategies of tobacco control, there have been mainly for last 30 or 40 years increasingly effective two strategies. One, increase awareness, including scare, like Dr. Gupta was saying. Second, legal enforcement of the provisions. What I believe for at least 30 odd years as a practitioner in psychiatry, mental health, and substance abuse treatment prevention is that the treatment or cessation of people who are already addicted actually used to fall in between two stools. Nobody was willing to pay attention to them. Neither substance use treatment professionals, nor psychiatry and mental health teams, nor many other professionals. What's great in every such occasion is that in last 20 plus years, at least turn of the century, there is many specialists from diverse backgrounds who are now getting interested in tobacco treatment. So that opportunity for interdisciplinary medical or health dialogue, actually,
Hmm.
this is a great platform, and all sessions like yours do that. I don't even need to emphasize that way back in 1984, tobacco dependence, nicotine dependence was well established. I will stop there for now before we go on to other things. Would you like me to elaborate more on treatment?
So we'll discuss that as well. But
Okay,
just one
so
line
let
on
others
whether
come,
you,
please.
yeah, just one line, sir. Do you think it is a societal problem? It is a personal problem. The inability to quit.
Sorry.
Is it a personal problem? Is it a problem that the whole society must be seized of?
Ah, okay. It used to be seen as an individual, personal, moral problem, willpower issue. That obviously shouldn't hold by now. And I'll keep saying again and again, including for all rural and semi-urban tobacco users, we need to apply the scientific model of addiction and a biobehavioral problem. Those
All
canny
right.
users to everybody, you know. And so about
Right.
that, there is no doubt at all.
Okay. You need personal willpower, and that is the most important thing to quit tobacco use. Now, Dr. Mohanan, tobacco is responsible for 20% of deaths from coronary heart disease, as smokers damage the arteries of the heart and restrict blood flow, which leads to heart attacks and strokes. So, when a patient comes to you, um, uh, do you is it important if he smokes? Could you tell us how tobacco consumption affects the heart health? And when you tell them, look, you're in a bad state, just stop it now. How amenable they are to just quit, stop altogether.
Thank you, Anisha, and thanks the entire folks who is doing a very good job in educating the public about the problems of tobacco, whether it is now whether you're smoking or otherwise. So I try to convince my patient that when you breathe in air from the atmosphere, the lungs take in oxygen and it delivers to the heart the quintessential pump, which works non-stop to the every part of the body through the blood vessels. But when you breathe in cigarettes, smoke, the blood is now it's contaminated with the 7,000 chemical that everybody tells about it, and it continue to damage. These chemicals continue to damage, and that applies to not only to the smoke. Now it's to every form of tobacco that one consume. It damages your vessels, your heart, and it initiates the process of inflammation and something like what we have seen in COVID. I always take a simile to my patient, the COVID. Now it started not as acute as COVID, but it gives you a chronic inflammatory status leading on to atherosclerosis, leading on to blockage of your vessels. And it alters and does many other things. As you rightly said, 20% of the heart attacks are attributed to smoking. And mind you, the global mortality is primarily due to cardiovascular disease. And whether you smoke a large number of cigarettes, or whether I smoke one or two cigarettes, the damage is there. And just one point also about the passive smoking. See, they also has a very heightened effects on the cardiovascular system by the smoking. Thank you, Anisha.
All right. And Dr. Sarnakar, when you're smoking, now that, because of COVID, lung health is really in focus. And 1 in 5 tobacco users will develop chronic obstructive pulmonary disease, which will affect their lungs in their lifetime, especially those who start smoking early. So, how many years does it take of smoking for smokers to really develop some problem with the lung?
So, I mean, actually, what happens is that actually the risk of lung cancer increases with both the number of cigarettes smoked per day, as well as basically the lifetime duration of smoking. And other factors also includes like also likelihood of developing all sort of lung cancer. Therefore, smokers include the age at the onset of smoking, and then also the degree of inhalation, the tar, and also particular nicotine content of these actual materials. So, and also the use of unfiltered cigarettes. So, actually, the cumulative lung cancer risk among heavy smokers may be as high as 30%, compared actually with just about 1% who's not those, I mean, just who are not smoking. So basically it takes years of thing, but it can happen in just about 10 years. It can happen in just smoking about 10 cigarettes. So as our someone just now said, that it doesn't matter how many cigarettes or then how many years, it does cause some of us damage to the lung down the line.
Right. Dr. Ashish Birla, people know, all doctors have told us, and most people, even if not very highly educated, know that this is going to damage their health, be it their heart, their lungs, the risk of cancer, all of this goes up, but they're still unable to quit because nicotine in tobacco is fairly addictive. So, what has come out as an alternative is nicotine replacement therapy. So, does this work? What are the possibilities in India for options of NRT? What are the possible options and dosages available?
Thank you, Anisha. So, NRT is available in various forms in India. It was first approved way back in 1984 by US FDA. So, it is available in patches, it is available in chewing gums, it is available in sprays. Some of the forms are available in India. Most commonly, it is the chewing gums which are available. And we are also looking at various alternatives which are going to be launched. Right.
Okay. What are these dosages, and I
So,
mean,
it
are they
is
easily
usually
available?
Yeah, so it is usually 2 milligrams and 4 milligrams. These are the two dosages which are usually approved by the regulatory authorities, out of which some of them are OTC, and usually most of them are usually based on the physician's advice. So we, as a company, we always advise that any quitting or any form usually has to take a physician role, which has to take precedence in this, and so chewing gums are really one of the most common things, but what we are now going to have an option is in the future right now is a lozenges, which are actually available across the world, and we are launching this in the first time in India right now.
Right. Uh, Mr. Nikhil Chopra, what is the role of pharmaceutical companies that they can play in, those wanting to quit smoking, or, in tobacco cessation?
Thank you, Anisha, and thank you all the panelists. First of all, for coming this morning, and also enlightening our audience who are on the Facebook Live. Anisha, coming to your question, the role that pharma companies can play, basically the insights that we have got from the market research and the unmet needs that we need to cater is both in the combination of medication as well as going beyond medication. That is what I talk about, going beyond the pill. So let us talk about more about the NRT, as Dr. Ashish Birla was talking about. Today, JB Chemical has understood two critical aspects of tobacco cessation from primary market research, and which is a combination of pharmacological and non-pharmacological interventions, which are critical to tobacco cessations. Now, when we talk of pharmacological interventions, we have looked at various formulations which are available in the world of NRT, and we have decided to come out with patient-friendly therapeutic options as compared to what are available in the market. And that is in the form of medicated lozenges, which will be available in mint flavor, sugar-based as well as sugar-free, 2 milligram and 4 milligram. And these lozenges currently are a part of our global portfolio. And for the first time, we are introducing these lozenges in India. And this is a starting point. We may come out with more lozenges formulations in other therapeutic options also. And coming to non-pharmacological interventions, we are also launching today. it is a moment of pride for us that we are launching today with the entire concept of Dr. Will chatbot, which is a comprehensive digital platform, which will enable doctors in counseling their patient to quit smoking. And that chatbot is a stepwise approach in terms of patient can come at any stage and go and at least pose a question of what stage they are in terms in the entire journey of smoking cessation, and the chat box with the entire intelligence that we have built up will be able to answer the patient in terms of what are the next step that patient should do. But at the end of the day, that chatbot does not replace anything to do with what doctors are doing with their patients. So this is a tool, additional tool that we are providing in form of non-pharmacological interventions for patient to quit smoking.
Right. I wanted to check with you, Dr. Gupta, that there are various forms of passive smoking, which another speaker highlighted. Now, as a tobacco user myself, I may think it's my health, it's fine. Do you think they would consider the health of others if they knew that their smoking would affect others, and perhaps that would be motivation enough for them to stop?
Of course, you see, the biggest challenge with the tobacco users is controlling the withdrawal symptoms and the cravings. They understand, with the amount of awareness that is there right now by the government, by the non-government, by the packaging, by the increasing the taxes and all these things. Every tobacco user, I would feel almost there is a WHO study which has shown that 50% of the tobacco users want to quit tobacco. However, they fail to quit tobacco. What I would say, they do not plan to fail, but they fail to plan. Right. So a proper system, when it is given to them, they are aware that the second-hand smoke that is to their near ones, to the unborn child, to the family members, it is affecting each one in the environment. Everything is being affected. They are 50% of the tobacco users are aware. Only those who are in the villages or in the rural area, probably they may not be aware. So these people are actually who need hand holding. And once they come to understand that yes, the cravings and withdrawals can be taken care by some systematic manner, they would definitely look forward. They would be highly motivated to quit. And I would just put it here. There are three important things when we talk about quitting tobacco: the willpower, the motivation, and the third is the commitment. The willpower will bring the patient to the site or to the doctor or to some person. The motivation will start moving him towards quitting, but the commitment will definitely make it successful. Thank you, Anisha.
You need willpower, you need motivation, and you need commitment. Dr. Mohanan, we heard Dr. Desai also says that we need a multi-pronged approach, a multidisciplinary approach for patients or for tobacco users to quit. But if I have a heart problem, I will go to you. I'll go to you, and you know that the tobacco has brought me here. So when you ask them to quit, how do you counsel them, and how amenable are they? Dr. Mohanan, would request you to please unmute yourself.
Sorry. I mean, we just listened to Ashish and Nikhil about the important roles of NRT and others. But then basically the changing behaviors and the taking medication will be the two main methods of quitting smoking. We have listened to the major experts about the failure rate of, you would have seen many guys who says that, oh, I have quit smoking 10 times. So now that is the attitude of our people. And so I think the making lifestyle changes to reduce, because why do they smoke? Because basically they want to have, relieve the stress. Every time you ask a patient, his immediate answer, I'm stressed up, doc, that's why I got a heart attack. Now, he doesn't remember that it is the other factors which led on to, all of us know, why we are the capital of heart attacks. India is the capital is because of the preponderance of the risk factors, like the huge number of diabetes, hypertension, cholesterol, smoking, of course. And smoking indirectly makes you hypertensive, indirectly make you a diabetic. So these are the, and also reduce your good cholesterol, increase your bad cholesterol, blah, blah, blah. And so basically he has to make that important decision that this is good for me and I have to relieve the stress. So what we suggest is we have, our team has an exercise program, which a vigorous exercise possibly can enhance his ability to stop smoking. Because we have to agree to the fact craving is something which he will have, and the highest failure rate happens during the first week. So a consistent support, friends, family, society, whichever way, the organization, if they can, as Nikhil was saying about an app, there are people who do go for personal coaches or group counseling. I mean, these are all the standard methods. I don't know how many of them are really using. Just a word about the availability of, now we don't, we also has, and apart from NRT, we can treat them with either Varnaclin or bupropion. We have two other important drugs available in the, I mean, not away. Varnaclin is very difficult to get. You have to import it possibly. We just published, not just 5 years ago, we published an article in Circulation Quality Outcome about the non-availability of these important medications in India. And we found that only 5% of our population, at least in Kerala, we are in Kerala, and we found out a so-called educated state like Kerala, the availability of smoking cessation treatment drugs are a dismal 5%. So that also is there. And it's
But
good
Dr.
that,
Mohanan, what is the cost of these drugs? Because if the cost is high, who will want to go in for this? It's much easier to keep consuming tobacco as well.
did you know, Anisha, how much it costs for a smoker every month? At least we have done some analysis and we found that a PD smoker will spend about 1,600 rupees a month. A cigarette smoker, if he smokes a packet of cigarette, he will spend about 2,000 rupees. I don't think nicotine patches or nicotine gum. I do agree, but this is not about your stress or your craving. This is about your heart, your lung, your cancer protection.
Dr. Mohanan, my question is about the drugs that are used for quitting tobacco, not the NRT, because the NRT is still affordable. But the drugs that you're talking about are not readily available in our country.
I do have a point. Varnaclin is an expensive drug, but bupropion is not that much. Bupropion is something found to be useful, and I think, and the drug levels that we needed may not be. Now we have only the Western standards of drug usage. Maybe we can give them at a smaller dose, find out once it is available and find out how does they work. I do agree, the acceptance of the drug is low because of also the cost. I do agree with that.
Right. Dr. Swarnakar, I've smoked for 10, 15 years. And, like Dr. Mohanan said, the cost of smoking is an important parameter. Now, my friend, she stopped smoking after when she became pregnant. She went back to smoking. So I said, Vani, why don't you just stop it? Just stop it and see how much you save. Then she told me, I stopped, and for a month, this is how much I saved. I said to my friend, after 6 months, you'll be able to afford yourself a Gucci bag. Why would you ever want to smoke? There's so much saving involved. There's so much saving in treatment. The public health cost is so much. So, for their bodies, Dr. Swarnakar, when they stop, will the lung damage reverse?
Yes, so there is a huge basically benefit whenever they quit, at what age, at what time. This is a material. In fact, stopping will always help at any time. So those who stop smoking reduce, actually there's risk of developing and dying from tobacco related illness for sure. And it is at any age, it is associated with, of course, substantial health also benefits for all people who smoke. And it also reduces basically lung function decline that would happen over the years if they just continue to basically smoke, and also risk of incident of COPD associated with smoking, which is they will also actually decrease. And all this thing has got immense benefits. So I think it's quite important for at any age, at any time when they of course stop, they will have immense, I think, benefit that has to be impressed upon them on each time that you actually consult them in your clinic. You have to be also very much what you call sympathetic towards them, even if they have tried quitting, and if they also come back again, you have to be very sympathetic and also tell them, address their challenges. So it's an ongoing process, so we have to be with the first patient here to use each and every opportunity to actually tell them the immense benefit of quitting at any time, at any age, because it has got huge, I think, benefits.
Right. We've already started getting some questions from the audience who are watching this show. And one question that is coming is, how effective is NRT? How long on an average will it take to completely quit using NRT? Dr. Birla, could you take this question? How effective is it?
Thank you, Anisha. So this is a very interesting question. Now, NRT, as you know, NRT is available across, and when we say NRT, it is not only when we start or how we start. So it is available in 2 milligrams and 4 milligrams. So usually a smoker who requires a cigarette, say within 30 minutes of getting up, they usually are started with the 4 milligrams of dosage, and everybody else usually can start with the 2 milligrams of dosage. So this dosage usually goes on a reducing schedule. In the first week, you're supposed to take, say, around 6 to 8, then keep on reducing this. Usually, NRT dosages are not given beyond 12 weeks, as Dr. Mohanan also pointed out. There are various other alternatives, but till 12 weeks, the patient has to try. And there is evidence, or there are studies which says that beyond 12 weeks, also patient keep on consuming this NRT. So again, that is the role where physicians actually play. And that is how they are also actually supposed to take a physician's advice on this. Now, how effective, if you ask me, they are quite effective. In fact, they should be considered as a cleaner form of smoking rather than, because every cigarette which I smoke or which anybody smokes will actually give me around 6 to 9 milligrams of nicotine. That way, yeah, somebody had to add something. So that's from my side.
Yeah. Anisha, can I add something?
Yes, please go ahead.
So I think what I heard from one of the panelists, that smoking cessation is a journey. It can't work that conceptually the patient is smoking and he stops smoking and he starts taking NRT. It does not work like that. And I think our medical experts will be able to throw more light on that. Conceptually, the number of cigarettes have to taper down. You can start adding NRT as a therapy combined with what counseling doctors or paramedics are giving to the patient. Equally critical role is of the caregiver. And lastly, I think what we are attempting in the form of a digital counseling tool, Dr. Will app, and there are many apps available like that, which conceptually patients should own it up and look at it as a partner which in the journey of smoking cessation. This is what I think, and this is what I have heard, and I've been talking to many doctors and many people, and I've spoken to some of the smokers also. This is how the entire approach has to be done.
Right. So it's a multi-pronged approach, and Mr. Chopra will come back to you to understand more on what Dr. Will is. But another question that is coming from the audience is, do you see counseling as an integral part, Dr. Desai? When you're trying to, quit tobacco, you're addicted to it. You can try NRT. Dr. Pavan said 3 things you need: willpower, motivation, commitment. Who will help you here? Do you need counseling? Is it an integral part of the process of it?
Would you like me to? Yeah.
I request Dr. Desai to say something, and I'll come to you. You're still on mute, Dr. Desai. Yeah.
Right. Thanks. Anisha, thank you. And I'm correcting myself, not Himani, Anisha. Thanks. Two things I want to recap from a lighter point of view, but that will be very important to what Dr. Mohanan had said. He spoke about how people actually don't realize they are killing themselves. In Freudian psychoanalysis, smoking and alcoholism were seen as chronic suicide. And so I'm completely with Dr. Mohanan's idea, and I think we need to spread this word more and more, that people who use tobacco and alcohol on a regular basis are actually indulging in chronic suicide. The other thing that Dr. Mohanan referred to was said by the American literature Mark Twain. And I quote, "It's very easy to give up smoking. I have done it a couple of dozen times," unquote. So that's the difficulty. And that's what the other colleague was saying about it being a journey. See, it doesn't work in black or white, day on today, day off today. One wishes it were so, it is not. The most important part to my mind in all this is that the quit rate with willpower, with commitment, with motivation, with counseling is anywhere only between 10 to 20 to 25% over a 3 months or 6 months. And there's very good data on that, including what we reported from the WHO network in India. The fourth important point in that line is, and which is why what some panelists have been saying is hugely important. Multimodal treatment is the best answer. You have medicinal treatment, you have counseling, you have whatever other support, even within medicines. Although it's a bit counterintuitive, by now there is good evidence for combining NRT with other pharmacological products like varenicline. So multimodal treatment is the answer. Let me also flag something else. Although, like I said earlier, a lot of people were not doing it. Now many agencies are doing tobacco cessation treatment. Psychiatrists and mental health teams and substance abuse teams are only good at treating the higher end of addiction. For most other people with tobacco treatment addiction, the best portal is the treating team. Because if I'm being seen by a cardiologist or a pulmonologist or a surgeon for a surgical or a medical problem, and he or she has saved my life, I'm going to be most receptive to listening to that team than some professor of psychiatry like Nimesh Desai. So what's important is that the treating team needs to strike it when the iron is hot. And that is what is now beginning to happen, fortunately. Yet if we say, how do you motivate? Commonest questions that physicians, surgeons have to us mental health professionals is, how do you motivate? It's easier for smoking because, as people said, passive smoking is the huge answer for prevention, social pressure, as well as individual cases. Children, other family members. The trouble, I must go back to that, the trouble with non-smoking route, which is very common in this country, is you can't use the argument of passive smoking for enhancing motivation. And there, the best thing to do, like public campaigns are now beginning to do, is actually show them the complications of what they have been doing, either in other related cases or in one's own self. So when you show a person what damage it has done to the oral cavity, that is what hits.
And that's on the cigarette packet, right? The image is there on the cigarette packet,
yes.
but they're still buying it.
I know, but I need to differentiate this, Alisha. See, larger prevention strategies is one goal, and there the whole strategy will be different. No? But here we are referring to more the individual clinic-based motivation of a person, and that it will work. One must say, some decades ago, there was some research about the benefits of quitting versus non-benefits of quitting. And this must be recognized because this is what gets bandied about. Just like the cardiological benefits of low rate of alcohol use, 2 glasses of wine being cardio beneficial. So there are these public health myths which are rooted in some epidemiology, but not in the larger truth. There was evidence in the 80s and 90s that unfortunately some teams produced that if you're already a smoker, if you quit, the CAD becomes higher. That was long ago. That's been disproved already. So there are no benefits to continuing to smoke or use tobacco.
Okay, so this is why we got you on the platform.
Absolutely.
Yeah, that is why we got you to this platform, to clear the myths, because there's so many half-truths all around. We're getting more questions from the audience. Dr. Swarnakar, one question that has come in is, how can we make sure that a patient would not get addicted to nicotine patches used for replacement therapy? Because Dr. Birla also said that, the recommended duration is about 12 weeks. There are people who go beyond this. So is there a risk that you get addicted to, if not the patches, NRT, like you pop in lozenges, you keep doing that? I mean, does that happen?
Are we saying NRT and varenicline combination?
No, Dr. Desai, the question is to Dr. Swarnakar from the audience that, how can you make sure patients do not get addicted to the NRT treatment? And, how do they wean off after 12 weeks? Because what Dr. Birla said is the ideal time period for one to quit.
Yeah, so NRTs are maximally actually given for around 12 weeks and they can be extended up to about 6 months. And this is a time which has been taken for this thing to consider that they would quit, of course, smoking. Plus, additionally, apart from these tablets which we give, we have to give them actually also because something to kill the urge as well. So here it lies actually the importance of lozenges, that even if you give them tablets, which we have just mentioned as also pharmacotherapy, as also primary treatment, you have to have also what we call something like patch, and in addition to that, you have to have these what we call lozenges, which can be taken often when they have an urge. So if you just combine these two the medication, there is a larger study which says that this helps much more. So it does happen, and quit rate, if you just combine these therapies, is quite good, and it takes 3 months to 6 months. And ultimately, Anisha, it's always there that there has to be a will to quit. It is not that basically we can just initiate everybody, but we should use each and every opportunity actually to also use them. We involve their spouses, we involve also their family members. We ask them to actually set a quit date, maybe at a time of birth dates of their children, so that they can remember that this I have a watch to stop on this date, and just kind of try to also give them counseling, as we were just talking about robots and all chat-ups and all those things, and behavior therapy. So all this, when you just combine all these things, the rate of quitting is quite good.
Right. Okay.
Anisha, sorry, I just have one line to say. When you compare what is available in the market in the form of chewing gums and what we are going to launch, lozenges, chewing gum, there is a irregular immediate release of nicotine when you chew, and there are some precautions which you have to keep in place as you have to part the chewing gum. But when you talk about lozenges, in terms of lozenges, there is a sustained release of nicotine. So that conceptually is more patient beneficial as compared to a chewing gum. That is the point that I wanted to bring when we were talking about lozenges as a therapy options.
Okay, so they work better.
Can I just get in for a second? One of the forms that people thought, fortunately, that's not very prevalent in our country, is the vaping, the e-cigarette concept, to sort of throw away the as a part of smoking cessation. But people should realize that is not the answer, and we don't have a conclusive proof yet. But it's true that any form of vaping, e-cigarette, whatever form, is also bad for your organs.
Okay, so e-cigarette is not an option when you're trying to quit.
It is banned in India actually by law. E-cigarettes are not available. Legally, they are not available.
All right. Dr. Gupta, another question has come, and this is for you. How likely is it for an individual who has quit to relapse?
You see, Anisha, basically what I would say, I will just add to what Dr. Desai had said. There are four important steps for quitting. Everyone has been discussing it, but I have just put it in a simple protocol. This is what I have been practicing. The number one is A, B, C, D of tobacco cessation. This is what I say: active, motivation, and follow-up. Number B is behavioral therapy. Number C is comorbid conditions that has to be taken care. And number D is drugs or these medications or whatever we are talking, that varenicline and others. So all these four together will make sure that these patients will have less of relapse. If we have a proper follow-up, then only these patients will have a chance that they will not relapse. If you look at the data in India, only 4% to 7% of the people have been successfully able to quit tobacco. And this is what is the WHO data. And the major problem is because of the lack of follow-up of these patients and continuous motivation, and then going with the regular checkups for these patients. These are the most important aspects. Just to add something, what Dr. Desai had said, this is basically the skill of the doctors. Like Dr. Desai has said, only the psychiatrists need to take care of the higher end of these people. Otherwise, it has to go down to every other
treating
aspect.
physician. You're saying the treating physician has to
yes, the skill
follow up.
Of every doctor. Like I'm an oncosurgeon, I'm a cancer surgeon, but I developed the interest and I'm doing it. And that is where I lost this eye care. So the skill of every person that has to be made, and that about the tobacco cessation. And tobacco is not a simple disease. I put it as a complex disease. And this complexity is that it just cannot be treated by the just giving writing a medical drug or medical some treatment or just writing an NRT. The patient will not quit. He will definitely have a relapse. We need to give all this A, B, C, D of tobacco cessation, and if you follow this plan, the relapse rate is going to be really low. And let me put it this way: the way I have been practicing, I have got a quit rate of 92% right now.
Wow.
That is what I am.
That is great. I want to
Just
ask one
again,
question.
Anisha, just one point. That
Yes,
basically
Dr.
because the cardiologist and the oncologist has an advantage because we see life-threatening diseases. See, and it is easier for us to convince them. See, that is the major problem. But I think it is, as Dr. Pavan has said, the quit rate in India is a dismally low percentage. And of course, we do have now if I convince my patient, your chance of developing another heart attack will be reduced by 60% by quitting smoking. At least that goes into his head. But that is not the case with the regular smokers. And we have to have a concerted effort by educating our patients of the importance of quitting.
Right. So, Dr. Beda, this is an effort to do that, to increase the awareness amongst people on the benefits of quitting. Now, like Dr. Mohan is saying, if a patient comes to me, he's in a really bad state. So when I tell him you got to quit, he understands, oh God, situation is grave. But for somebody who hasn't reached there, how does he start? And many people feel, I go to a doctor. Most people in India have this mentality. जब तक चल रहा है चलने दो डॉक्टर के पास क्यों जाए तो for these people can they just buy the lozenges if they want to give the shot on their own should it be done independently of any of the doctors involved what do you advise?
Most of the NRTs are available OTC. So, but we usually always that as a responsible marketer, we always ask patients or we always request patients that without a doctor's advice, even starting to quit it may not be actually beneficial. So regarding this also, what I say is that 2 milligrams is OTC and 4 milligrams is on a doctor's prescription. So they can actually go ahead, they can start quitting, but always based on a physician's advice. And what we also have introduced here is Dr. Will, that is the AI chatbot, which Mr. Nikhil also just told us right now. So this AI chatbot is actually something which will support a smoker on his every stage of smoking. Say if he is starting, like he just decides that one day I have to quit smoking. So he can just put in this option there that I have to quit smoking. What are the next steps which I need to follow?
All right.
Dr. Anisha, sorry, once again, one couple of minutes. See, the commitment from JB Chemical is to bring more awareness about smoking cessations. Ultimately, that is the objective, and to help more and more patients with the help of doctors to quit smoke. And we'll carry out many digital initiatives. Dr. Will app is one of the AI-based WhatsApp chatbot that we have put. And as Dr. Ashish Birla was telling, 2 milligram is a OTC product, which is today marketed and over the counter. Patients can buy and chemists can sell, and 4 milligram is a prescription product. But our commitment remains to the medical fraternity that we will go and approach the right option in terms of talking to doctor about the therapeutic option in the form of lozenges, and carry out many digital initiatives which conceptually is more towards patient awareness. Tomorrow, at the end of the day, the critical role, Anisha, I think people have been talking, is also of the caregiver, because many people accidentally launch in the clinic of a doctor with comorbid condition, and then the doctor gets to know that this guy is a chronic smoker. So there, overall, the support from the caregiver, doctor comes into picture, and then giving the option of NRT, bupropion, depending upon availability, and a continuous counseling, which has to happen. So I just wanted to bring that point on the table.
Right, Mr. Chopra, but the best would be that people start stopping before they get to the stage to go to Dr. Gupta or Dr. Mohan. You know, this is what we're trying to do. Tell them now. Don't wait for this. You can do it now. Dr. Desai, what is your experience on tobacco withdrawal symptoms?
Tobacco withdrawal symptoms, like I said, were recognized, documented in the 1980s, mainly about irritability, insomnia, headache. And yes, they can be very bad, but like a lot of colleagues said, the most disturbing and critical withdrawal symptom is the craving. And so that is where NRT, behavioral methods, and other chemicals are very useful. We also sometimes use specific anti-craving agents which are serotonergic. Anisha, let me pick on some of the things that were said. One, I'm so impressed with what Dr. Pawan Gupta said and Dr. Mohan has been saying. We all know about how all physicians and surgeons in today's world need to learn to deal with lifestyle disorders. The issue of tobacco and alcohol is one step even over above that. I will say biobehavioral disorders, as Dr. Gupta said so well. And so unless the treating physician and surgeon and his or her team learns to level up those skills for dealing with biobehavioral problems, obviously the success rates are going to be low, which is where to link that to, although some of these NRT products may be available OTP, it is not a good idea to encourage people to just pick it up and start using. Go to a health professional, go to a mental health professional, recognize the issue, and then start treatment. I'm really excited about both the things that Nikhil Chopra said. One is lozenges. One, because in all medical practice, I think, but certainly in neuropsychiatric practice combined, I have been very impressed with the benefits of controlled or time release preparations. Pharmaceutical variations actually bring a whole lot of benefits in addition to the pharmacological molecules. And so I'm very excited about what Nikhil Chopra described. The second part that he said also I'm equally impressed with is to go through accredited health professionals and physicians rather than going to the market directly. Can I also touch a sensitive issue there? I'm sure all colleagues here are more than aware and mature to handle this. But Anisha, all of us, and if we have Facebook listeners, I think we need to recognize that tobacco and alcohol use both are actually very much more common in doctors as compared to general population. And the local communities and friends and family members do watch as to how do physicians who have alcohol or tobacco problems deal with them, which is also very much like, I think, what I heard Nikhil say, that besides they reaching out to the doctors for getting the ideas and the molecules and the products to the market, there should also be that not so hidden but subtle, very polite agenda to help physicians with tobacco and alcohol problems. And that's not an easy job, I can tell you with a lot of experience. Tobacco and alcohol issues in physicians, or including psychiatrists, let's admit, with tobacco and alcohol problems. But doctors with alcohol tobacco problems is a much more complex issue. But we better deal with it.
All right. So
I just want to add one thing.
Can I also say, Anisha, I'm sorry, can I apologize? I have another webinar at 11 that I need to lead. And so if you and all the other colleagues will forgive me, this has been huge benefit and pleasure. If we can remain connected. Can I excuse myself? Sorry about that.
Thank you so much,
Sir,
Dr.
just
Desai,
before you leave, just I want to just add one thing, sir, about the doctors and physicians. I just have it is an ongoing study that I am doing on the doctors, why intellectuals continue to take tobacco. This is my study. And it is still continuing. So maybe we will talk about that later. Thank you so much.
Yes, bye, sir. Bye, everyone. Thank you so much.
Thank you, Dr. Desai. Thank you.
I can't be very certain about. I can't be certain about the alcohol, but I am certain about the physician smoking habit has tremendously come down.
Mohan, sir.
Yes.
Even if this is a public platform, let's be candid. I'm sorry, with all the IMA meetings, alcohol.
Right. We all have agreed that we have to
Anisha,
quit, whether it is regular people or it's physicians, it has to be done.
Last comment from Anisha, we'll be more than happy to first help the doctor community, then the patient community.
Right.
On the lateral side.
You are going into a very difficult thing, because my study shows it is very difficult to help a doctor quit, and they are the worst patient. I just recently had a IMA meeting in which I had my presentation was only on this: why intellectuals take tobacco and what is the challenges, why they are not able to quit tobacco. And I'll tell you, when I released this study material, some of the doctors actually were ready to hit me. Right. So it was getting the right candidates and actually expressing the reasons by the doctors is really very surprising things that comes up. So it is the most difficult, and if you want to do that, it will be you are going to fail in that.
Anisha, this is a very interesting talk which has been taken by Dr. Pawan. Could you just play the Dr. Will video for us? Actually, this will be a very interesting perspective for everyone to go through right now.
Yes, Dr. Pilla, I would first request Nikhil to please tell us a little more in detail about how Dr. Will works. What is it really? It's technology, it's digital, it's AI. But for a person who is going to try it, Nikhil, could you please tell us what really Dr. Will is about?
Yeah, I would like. So, Anisha, Dr. Will conceptually is the initiative that we are putting in place, which conceptually is a part of non-pharmacological treatment option that we want to provide to the patient who is suffering, who conceptually wants to be a part of journey of smoking cessation. Basically, Dr. Will is designed. It is a AI-based enabled chat box to educate and counsel the patients, and the chat box will answer patient queries at different stage of journey the patient is in the journey of smoking cessation, and make more relevant information and support to the available users as is. And it is designed with the support mechanism to help and hand over the entire journey of smoking suggestions along with doctor community. That is what I want to emphasize, because we don't want to do anything in isolation which conceptually does not work. Because as earlier also what I told, smoking cessation is a journey which is a combination of patient with the caregiver, with the doctor, with what role pharma companies can play in giving the options in terms of pharmacological treatment. And this is the option that we want to get into, providing the patient going beyond the pill in terms of some as a companion in terms of what patients can pose the questions to the chat box, and they will be getting the relevant answers. And these all answers and everything which we are trying to put on the chat box is based on all the scientific research that we have done as a company. And once again, as my concluding remark before we go into the video, I would like to thank all the panelists who are there on the call today. And JBCPL as a company continues to commit for the well-being of the patients in terms of what more we can do with different variety of therapeutic options. Nicotine replacement therapy lozenges with 2 milligram and 4 milligram would be available with the brand name No Smoke, NOSMOK, sugar and sugar free. And also with No Smoke lozenges, we are also coming with other options of lozenges, particularly for dry mouth. We are launching one lozenges. Also, will be launching lozenges for immunity boosting. That is combination of curcumin, vitamin, zinc, piperine. So these are all things we want to do in terms of provide patient-friendly therapeutic option. Starting is No Smoke nicotine lozenges, and the journey will continue.
Right. Let's see the video now.
Yeah.
So of course, Nikhil, it's very good to name it as Dr. Will, in fact, because this is what it focuses. So I really appreciate the name that you have given to this chatbot. So that it sums up basically the process of.
Congratulations on the launch.
Congrats.
Mr. Chopra, or Mr. Pilla, if you could add, Dr. Will is an app that can be downloaded on an Android, iPhone. Does it have a community? Because they're on a support group for de-addiction. Does it work like that? Does it have a community and connection platform?
Let me just add something more about Dr. Will right now. So just to inform our audience and the panelists who are there live right now, Dr. Will Facebook page is actually active. So you can go ahead and like this. The actual app or the actual counselor will be live in about a week or so. We are right now starting in English. This will be on WhatsApp. So all privacy and all the policies which are available, they'll all be maintained. We'll be trying to ensure all of that is taken care of. Plus, initially going forward, we are available only in English, but in the future, we'll also be available in regional languages. So people who really want to actually understand in their own language, they can go ahead and do this. And there is no need to download this app. You can actually start or just start chatting with the counselor right now. That is the advantage of this app. There is nothing to download. There is nothing to do anything of sorts. The second biggest thing is this will be extremely customizable. So say today, if I just decide that I have just smoked for some time and I want to smoke for say 1 or 2 weeks, I want to stop smoking within 1 or 2 weeks. I want to stop smoking immediately. So that is the way this app has been customized. Whether I can, do I have some times for smoking? Do I have to stop smoking immediately? What are the problems which I face? So all those, like just Dr. Desai actually pointed out, what are the cravings which you see? Everything will be taken care and will be addressed in this app right now. I hope I have answered your question, Anisha.
Yes, and then the good part is you don't have to download any secondary app, etc. It's readily available. And for Facebook, you go to Dr. Will's page and you like the page, and that's how you get updated with whatever is happening on the page, right?
It will be active right now. It is live right now, but the counselor will be live say within 1 or 2 weeks right now. So we are just working on the finer nuances. Once the nuances are cleared, we'll actually be putting it out again live, and there will again request your support again there to put out to the wider audience also for the wider benefit.
All right. Thank you so much to all of you for joining us today, and congratulations to the JBCL team for coming up with a really nice app, Dr. Will, that will be a companion for those wanting to quit. Plus, the lozenges is something like all doctors have agreed is an effective NRT tool. Congratulations to you on that, and a big thank you to all the doctors who joined us, Dr. Mohanan, Dr. Shankar, Dr. Gupta. I was witness your knowledge, insights, and how you handle your patients. How this is a journey of quitting, where the doctors and the smokers work hand in hand, along with companies that offer you an NRT option of lozenges, of Dr. Will app, which is also a personalized way to continue this journey of quitting. Thank you all for joining us today.
Thank you.
Thank you.
Thank you, Anisha.
All the
Thank
best.
you all.
Bye-bye.
Thank you.
Thank you.
So quitting smoking has health benefits at any age, and no matter how long or how long you smoke, it helps, it benefits. So make that decision today. There are many things, many people who will help you on your journey. You can do this. You need will, determination, and commitment. And there are many people there who will help you for this. And just think about your family, the benefits to your family. Your family needs you more than you need tobacco. Just think about that. And on this No Tobacco Day, make that commitment to yourself that you will do this. And there are many people there who will help you, physicians, and of course, NRT treatments and a hand-holding app as well. Thank you all for joining us. Stay tuned to our shows on IHW Council. Do like our page, do follow our page. We have lots of updates coming in for your health and well-being. Thank you so much for watching.